We have another caller from Charlotte. Hi, is it Naristas?
Narissa.
Narissa, hi,
Yes.
welcome to Healthwise.
Hi, I just turned on, so I've missed the first part of your show, so my question may be a little redundant.
That's okay, we have new viewers all the time.
I have an 8-year-old who's going to have his tonsils taken out in December, and he is highly scared of needles. And I'm just, they couldn't, whenever he had a physical a few weeks ago, he was like, nope, you're not taking blood from me, sorry.
Yeah.
I mean, he literally, he's 8 years old, he got up and he walked out.
Okay.
So my question is, how am I going to, get him there, and how are they going to deal with him to be able to get him to do all that?
So the question is, can we do this without needles?
Right.
Let's see what they have to say. Dr. Stowe?
Well, I think that is a very common concern among an 8-year-old. That's completely normal. One thing you can help your child with is to talk to him about the procedure and explain what's going to occur. And there are books out there that you can get on preparing your child for anesthesia, and actually a specific book on having your tonsils out. I don't know the name of the book off the top of my head, but there's a book out there about explaining to kids about having their tonsils taken out, that you can just talk with your child, explain what's going to happen. And for most 8-year-olds, when they come into the hospital, we would give them a little sedation medicine orally to relax him, and then bring him in the operating room after he's sedated and put him to sleep with a mask, like this one we've shown here before.
Right.
And once he's unconscious, then we place the IV. So yes, there is a needle involved, but it's placed after he's unconscious, so he will never know about it. He will wake up with the IV, but at that point, the needle is out of the IV, and it's just a little piece of plastic, like a small little drinking straw, taped into his vein.
So we'll take it one step at a time.
Can I just, one other point. We can place an IV painlessly by using those tiny little local injection or some cream, but we can't make it less scary. And so a child at that age, we're not going to be able to talk them into an IV, and so we do give them medications by mouth before we get started to make it easier for them.
Okay, great. Thank you so much.
Good luck. I really hope that this turns out to be a good experience, and I'm sure he'll feel much better once he has those tonsils out. I kind of had a similar experience. I think I was a little younger than 8, but that was something that I can still remember, and that was what, 40-some years ago. So do you meet your patients years later? Has that ever happened?
It actually happens frequently, where patients will come up to me and you'll recognize them from the hospital or having taken care of them earlier. So yeah, frequently.
Which leads me to a question that I have to ask you. You guys, at the top of the show, we were talking that you're all medical doctors, and you went this route with your specialty, and you had to have enjoyed children in your lifetime, and you still do. Why are you in this profession?
For me personally, I did pediatrics before I did anesthesia. I was always interested in doing pediatric critical care, and anesthesia is a lot like critical care. There's I just always had an interest in taking care of children in that kind of a setting.
Right. And as far as just realizing that you're helping a young person who is going to be the next generation, I don't know, it's like building blocks. That has to be a real satisfaction, Dr. Stowe, to know that you're out there helping these young folks.
Yes, every day at the hospital is a satisfying experience. And the practice of anesthesia, specifically pediatric anesthesia, is not only a science, and obviously there's a lot of science and medicine behind it, but there's also a good degree of art behind it, I'd like to say.
Really?
You have to know how to interact with the children and play games with them.
Right.
And if you build a good rapport, and we've talked about this before, it really makes things easier once you get them back to the operating room.
Oh, let's expand upon that, Dr. Evac. So you have to have that relationship and make sure that the child feels comfortable with you. Mom and dad may feel comfortable with you, but you want to make sure the patient does.
I personally use a lot of different techniques, and it depends, if it's, I have 2 girls at home,
They're watching Dad right now.
So it depends if it's a boy or a girl for me, actually. And, you know, if it's a girl, you know, my girls are 9 and 11. I remember, you know, different stages and things they like. So I'll try to build on something. If they come in with a Barbie shirt or whatever or if they have nail polish on, you know, their favorite color, we'll start with things like that, and then I'll tell them that the mask, the anesthetic gas, actually smells a little bit like nail polish remover. And did your mom ever paint your nails? Now, if it's a boy, you know, if he comes in a Panthers, you know, shirt or some other Spider-Man gear, which two currently things in vogue, you know, we'll start up a little conversation about that, and I'll tell them we're going to go back and play Spaceman, and that we're going to put the fuel in the rocket and as we go to sleep, and tell them a story as they're going to sleep. And those are, you know, two techniques. I mean, you find something that they're going to relate to right away.
Well, it certainly takes an art, and it takes a science, and it has to take a special person to be in this field. And we thank you so much for being here. Final thoughts. You have 15 seconds.
Well, thank you for having us. I've enjoyed this tremendously, and like I say, it's a great privilege to be able to take care of the kids and all of us.
It really comes
a great
across.
Responsibility.
Well, it certainly comes across, and we thank you so much for being here. Dr. Brent Holway, Dr. Barry Stowe, and Dr. Richard, you like to be called Rick, right?
Rick.
Yevac, thank you so much. From Southeast Anesthesiology Consultants. Just putting our minds at ease this last hour. I've learned so much, and if I should have a loved one about to go for a procedure, I think it's going to make me more at ease myself, knowing what takes place. If anything, just the study and the research that goes into the care for our little ones when it comes to sedation. Once again, thanks for being here.
Thank you.
Thank you, Joe.
Thanks.
And we thank you so much for tuning in. As always, we hope that this medical broadcast has helped you become more health wise. Hey, if you have an email question, send it to me, jpop@wtvi.org. I'll pass it along to these guys.